afternoon, everybody. This is Congressman Mike Levin coming to you live from Washington, D.C. It's good to be with you for another virtual town hall. We've got some excellent guests today, as always, and whether you're with us on Facebook, YouTube, or Twitter, or on our website, I'm so glad that you're here. I want to thank my amazing staff, both here in Washington, D.C. and in our district offices in San Diego County and Orange County for all of their hard work. And I want to thank Jeremy for doing a great job with our video conference for this, I think our 33rd virtual town hall since the pandemic started. Before we dive in, I want to take just a couple minutes and honor the life and legacy of a dear friend and colleague who passed away on Friday, Congressman John Lewis. He had been sick for the past several months with pancreatic cancer. He was in very good spirits when I last spoke with him. And as I said the other day, that I got to befriend and work with John, somebody who I looked up to my entire adult life, a towering figure of the civil rights movement and the conscience of the Congress, to me is almost surreal. Christy and I got to take a trip with John that I'll never forget to Selma, Birmingham, and Montgomery. We crossed the Pettus Bridge with John where he had been beaten badly on Bloody Sunday. I think that bridge should be named in honor of John. But I know if John were listening now, he'd tell me to keep fighting, not give up, keep moving forward, fight for voting rights, fight for equal opportunity, fight for peace, fight against hatred and oppression and voter suppression and racism in all its forms. In fact, just minutes ago, before coming up to the office here, I voted for Confederate monuments to be removed from the United States Capitol. It's the very least we can do to honor John's legacy, and much more to come. But John would also say, don't be afraid to get in some good trouble, necessary trouble, to keep moving our country and our planet forward. I'll continue to fight for that legacy. I'll continue to teach our children. Christy and I are going to continue to teach our children about John, what he did, what he stood for. And I hope that we in Congress can honor the legacy of the great John Lewis. With that, let me introduce this week's guests. I am really excited that they're here and would like to turn to some other topics for discussion. This week, I'm pleased to welcome Dr. Julie Vitale, Superintendent of the Oceanside Unified School District. Dr. Vitale's career spans 26 years as a teacher, assistant principal, and district administrator. She was a superintendent at Romaland School District, assistant superintendent at Monrovia Unified School District, and held leadership positions in the Corona Norco Unified School District. Dr. Vitale is also an adjunct professor at Concordia University. Dr. Vitale, thanks so much for joining us.
It's my honor. Thank you for having me here.
Wonderful. Well, and for those tuning in for the first time, we are always honored, and we're honored again to welcome back Dr. Karl Steinberg. Thank you, Karl, for being with us again. He is a leading nursing facility and hospice medical director in North County, earned his bachelor's degree from Harvard, went to The Ohio State University College of Medicine, and completed his family medicine residency at UC San Diego. Again, Dr. Steinberg, welcome back. I think this is about your 12th one of these. So we're very, very grateful for all the excellent advice and public health information that you're providing for our constituents during this very difficult time where there's a lot of confusion. So the advice that you provide is really important. Very sadly, we've now passed the 142,000 mark of those who have lost their lives due to COVID-19. Those numbers are astonishing, and there's so much more than statistics. But really, our loved ones, our sons and daughters, brothers and sisters, husbands and wives, mothers and fathers, friends and loved ones. And I just hope that we take a moment and we recognize and we honor those who have lost their lives and their families who have dealt with this unspeakable tragedy for our country. The United States, as you may know, is rapidly approaching 4 million cases. We've now got 3.94 million when I just checked, 142,677 deaths. California, you've probably seen, now has the most COVID cases in the country, 414,992, approaching 8,000 deaths. I represent both San Diego and Orange counties, so I like to give those numbers, and those two counties are roughly comparable in terms of their population, about 3.2 or 3.3 million people. So you get a good sense of how those two counties are doing. San Diego County has confirmed 24,520 cases, 24,520, and 487 deaths. Orange County has confirmed 31,743 cases and 521 deaths. Now, for those who've been watching us since March, those numbers have flipped. For most of March, April, May, and on into June, San Diego County had more cases and more deaths. Just recently, in the last month or so, has Orange County really, had a real rise in infection and, unfortunately, in hospitalization and in death. Both counties are on the governor's watch list. Most of the state is right now. But it's very troubling. Statewide, California has 58 counties. 35 of those counties are currently on the watch list. In the penalty box, you might say, if you're a hockey fan. That's 94% of the state's population. And that, obviously it includes most of Southern California, I think all of Southern California, and certainly includes San Diego and Orange County as well. And the way that the watch list is calculated depends on a variety of factors: infection, positivity rate, and others. But we're not just over; we're considerably over. Orange County, last I saw, was actually double the infection rate necessary to get off that watch list. Now, what we're seeing statewide is hospitalizations are going up. The reopening is rolling back. The governor has returned to stricter lockdown rules. Masks are required across the state. And Governor Newsom announced last Friday that all schools located in counties that are on that list, so again, that includes all of our schools, must not physically open for in-person instruction until their county has come off the monitoring list for 14 consecutive days. Schools and counties that have not been on the monitoring list for the prior 14 days may begin in-person instruction following some very strict guidelines, including a strong mask requirement and a strong physical distancing requirement. The state has set aside $5.3 billion in additional funding to support these efforts and to also support more robust distance learning that is rigorous and grade appropriate. But I have to tell you, and I was telling our guests before we got on the air, I take this very personally. My wife and I have two young kids at home, 8 and 6 years old, and we know that it is important for all of our children to safely get back to school. But we've got to make sure that we follow the health precautions and the guidelines in Orange County and in San Diego County so that we get off the watch list. The quickest way we get the schools reopened is we get off the watch list for 14 straight days. That means we need to follow those guidelines, simple as that. Moreover, if we are expecting our schools to reopen, we need to provide them with the resources necessary to get that done. Back in the end of March, we passed the CARES Act. It had $13 billion for K through 12 instruction. And that wasn't enough to get through this pandemic. At the time, we'd hoped it was. It's simply not enough. So our new bill that we passed now 2 months ago in the House that's sitting in the Senate, called the HEROES Act, would provide an additional $58 billion for K through 12. We are hearing kind of anecdotally and in the press what the Senate proposal will be. I'm encouraged that they care about school funding. I think it's important, but we're going to have to see the bill. I was asked today by a reporter what I thought, and I said I can't comment on something until I've actually had the chance to read the actual details. So we put our offer out 2 months ago, in fact, more than 2 months ago, and they want to know our position. that is our position. The HEROES Act is where we stand. So now we need to see where the Senate stands, and hopefully we can come together just as we did 4 other times, and we can pass a 5th major bipartisan COVID relief bill that includes funding for our schools. So on that note, again, I'm very pleased to have Dr. Vitale with us. I wanted to dive a little deeper into discussing next steps for our schools during the pandemic. So I'm going to turn it over to Dr. Vitale for any opening remarks on safety plans and next steps for our schools. And thanks again for joining us.
Thank you so much for having me on. I'm proud to represent the Oceanside Unified School District and districts in our county. We've all been grappling with this since March 13th when we closed our schools and throughout the summer. And safety is absolutely a priority. And I personally was actually quite pleased with the governor's order that came down on Friday, July 17th, especially his strong take on masks. As you know, that had been, it's a controversial thing that exists. And he was very clear that when staff does come back to work, they are required to wear masks. And we are providing those for our staff. We're providing both masks and face shields if people would choose to wear those as well. And the mask requirement when students are back on campus is required for 3rd graders and older, and recommended for 2nd grade and under, and we'll be providing masks for them as well. We've also, and I will say that of course I can't speak for all districts, but I know that all districts in this county especially, and in all counties throughout the state, and districts, all 1,000, I'm sure, throughout the state, have been working on this all summer, and since we closed on March 13th, and have been preparing for students to return, because it's absolutely what we want. We just need to ensure their safety. So along with the PPE, we've also been preparing our sites with all different kinds of signage to remind people to wear their masks, to remind people to keep their social distance, and of course to wash their hands, use the hand sanitizer that we have throughout the campuses. We have extra cleaners throughout the campuses. We're looking at ways to expedite sanitizing our campuses so that can be done on a daily basis when we come back. So the preparations have continued, and we will be ready when we can finally open, and we'll all be excited to have our scholars back on campus. And until then, we are preparing that robust distance learning environment for our students. And you talked about the money that's been appropriated, and we're going to spend every dollar, and hopefully those additional dollars that you'll get us. And it will really move all districts forward on providing the instructional technology that has been desperately needed in our schools, and of course the connectivity that many of our families need. So,
well, thank you for, in general for all that you do for our children, but particularly during this time. We so appreciate the work that you and educators all throughout our district are doing. And that's part of the reason we called it the HEROES Act, is to make sure that our teachers and our school superintendents and administrators, principals, you are our heroes. So we're super grateful for all that you do. And we're going to have a ton more questions, I'm sure, that you might want to weigh in on. So stick around. Again, I wanted to kind of do a reset on everything that we've done. And I try to do this, just put it in context where we are today. In terms of the federal legislative response since March. February 12th was when I first got briefed on the severity of COVID-19 by Dr. Fauci and others. And his story has been remarkably consistent throughout, responding to the facts, trying to, in a clear-headed way, present the evidence. And then on March 6th, we passed our first COVID-related bill. Turned out to be pretty significant, $8 billion for the development of a COVID vaccine. And we've already seen, as that money has begun to be distributed, we see scores of companies that are working on the development of a vaccine, and ultimately that's how we're going to get out of this long term. But I'm very proud that we did that. Originally, the administration had only asked for $1.25 billion in new money, and we upped that to $8 billion back then. Moreover, middle of March, we did the Families First bill, $200 billion for everything from emergency sick leave, nutrition assistance, Medicaid support. Then end of March, we did the CARES Act, $2.2 trillion. Expanded unemployment insurance, you probably know that's going to be running out any day. Direct cash payments of up to $1,200. The pandemic unemployment assistance for the 1099 independent contractors and gig economy workers. Paycheck protection program, first tranche of funds there. That's now been a $670 billion program, although there's a bit of money that's remaining in there for our small businesses. And then, of course, a lot of money for testing, tracing, and all the rest, all the things that our hospitals and our frontline medical community needed at the time. And 2 months ago, we then passed the HEROES Act. And the HEROES Act is a bold and ambitious but necessary bill for lives and livelihoods, for everything from state and local government, $875 billion for our state, local, tribal, and territorial government. You know, the CARES Act had $150 billion, of which $15.3 billion made its way to California. We know now that as a result of the pandemic, California has gone from a $21 billion surplus to a $54 billion deficit. The CARES Act funds could not be used for revenue recovery. They can only be used for direct COVID-related expenses. We need to have more flexibility with that funding. In the HEROES Act, we give it. We also support our local smaller cities of 500,000 and below. CARES Act was only 500,000 or above. And so that's so important to our community because Oceanside, Carlsbad, Vista, San Clemente, Dana Point, these are all smaller, much smaller than 500,000. So that's where all 9 of our mayors, 6 Republicans, 3 Democrats, all came together, signed a letter saying we need this funding for our communities to help recover the lost revenue. As I'm sure you know, our district has so much revenue from tourism. Transit occupancy taxes are way down. Our hotels are struggling. Restaurants, it's a real mixed bag. You know, they're trying to do outdoors and takeout whenever they can. But we basically said, here's where we stand as the House of Representatives. We passed that bill back 2 months ago. $100 billion for low-income renters, hazard pay for our frontline workers, $25 billion for the U.S. Postal Service. So critically important that we do all we can to save the U.S. Postal Service. And look, it was an 1,800-page bill. I don't expect Mitch McConnell and the Senate Republicans to agree with all 1,800 pages or with every single provision, but I do expect them to act. And here we are 2 months later, and they're talking about a bill, but we haven't seen a bill. And I'm eager to see that bill, and I'm eager to see our 2 chambers work together and come up with something for the people. We've tried to move things forward independent of that agreement, such as the Postal Service. I led a letter with 137 members calling for $25 billion as a lifeline to the U.S. Postal Service. The USPS handles 48% of the world's mail, has 650,000 employees approximately, over 100,000 of whom are veterans. So critically important that we support our veterans. I was so honored that earlier this week we passed one of our veterans bills that I've been working on for some time with my friend Gus Bilirakis, Republican of Florida, who's the ranking member on my subcommittee for Veterans Economic Opportunity. That's an area where we ought to come together, is to support our veterans and support the 100,000 of them that work at the U.S. Postal Service. Look, there are more than 142,000 Americans tragically dead. We see that the pandemic is not over. Even the President of the United States yesterday, said it's going to get worse before it gets better. This is no time to take our foot off the gas. We've got to stand up and we've got to fight for our states, our cities, our local communities, our schools, our families, our frontline workers. We cannot take our foot off the gas, and we won't allow that to happen. The other thing that's very troubling to me is that in the middle of this pandemic, at a time when families need affordable health care more than ever, this administration continues its attack on the Affordable Care Act. We know of the hundreds of thousands of Americans who have filed for the ACA this year. We know of the millions whose health care from their employer is no longer available because they've been let go by their employer. We know that many of those jobs are not coming back anytime soon, unfortunately. And we know that in our district alone, 47,000 people rely on the Affordable Care Act. So the fact that they would try to eliminate the protection for pre-existing conditions, those are just the facts. That's what they're doing. Watch what they do, not just what they say. We've got to stand up and we've got to strengthen and protect the Affordable Care Act. And so we passed something called the Patient Protection and Affordable Care Enhancement Act, which strengthened the ACA. That's what we need to do. A couple other legislative updates. I talked about the Paycheck Protection Program. We've now put $670 billion into that program. You can apply if you're a small business owner through August the 8th. And the PPP has been a mixed bag. It has sustained over 20,000 small businesses in the 49th district. The employment from those businesses is over 240,000 employees. Not all of them live in the 49th district, but nonetheless, those are the jobs, the employees of those 20,456 small businesses. And that's more than $613 million in federal funding. So I think there were some PPP recipients that shouldn't have received the funds. And I think there were others who desperately needed that money who didn't get it. Overall, I think that program did a lot of good. And I think we need continued accountability and oversight, but I think the program at the end of the day was very important. And we now know it's saved, according to their estimates I saw today, between 1.5 and 3.5 million jobs as a result of the work that we did. The other thing I'd like to talk about that I was talking to our guests about before we got on the air is the Great American Outdoors Act. So we just voted on this. We just passed it with 310 votes in the House, bipartisan support. It passed 73 to 25 in the Senate. It will be sent to President Trump. He's already said he's going to sign it. And this is the biggest bipartisan win for the environment and for conservation of our public lands in decades. What the bill would do, first, it would fill a multi-billion-dollar backlog, multi-billion-dollar hole for our national parks, create a $9.5 billion fund to help that backlog. So if you're like me and you grew up going to some of our beautiful national parks and you want to see them stay the way they are and continue to be improved for future generations, you'll be very happy about this bill. The second thing that it did is fully and permanently fund what's called the Land and Water Conservation Fund, LWCF. That fund goes to over 40,000 local and state parks. So if you're in the 49th district, places like San Clemente Beach, Carlsbad Beach, San Onofre Beach, Torrey Pines, all get LWCF support. Very proud that we got this done on a bipartisan basis. I was proud to be one of the original co-sponsors of the bill in the House through the Natural Resources Committee where I serve. A great accomplishment. And I think it's, it's one of those examples where sometimes good things happen unexpectedly in Washington. The other thing I wanted to mention is that we passed the Bipartisan National Defense Authorization Act, and the bill included $105 million in federal funding for military construction projects at Camp Pendleton. And it includes my amendments to strengthen the Transition Assistance Program for service members returning to civilian life, expands protections for troops under the Service Member Civil Relief Act, adds $5 million to the Naval Research University Initiative, which works with universities like UC San Diego on defense research. Also includes an amendment I co-sponsored to expand eligibility for the HUD-VASH voucher program, and includes a provision authorizing a 3% raise for America's troops that I strongly supported. So this strong bipartisan bill includes a number of provisions that strengthen our national security, honor our values, and support our military families here in the 49th. Finally, I'd like to mention our Justice and Policing Act, and I stand with millions of Americans in wanting to make sure that we have comprehensive reform to our system. I have tried as best I can to be a bridge builder between our local civil rights leaders and our local law enforcement community. We had a very productive conversation recently And I'm hopeful that the Senate will continue negotiating the Justice and Policing Act under the great leadership of my friend Karen Bass, who's the chair of the Congressional Black Caucus, and Cory Booker and others, Kamala Harris in the Senate. I really hope we can get this done. Very last thing, 2 reports that I want to mention. One is the report of the San Onofre Nuclear Generating Task Force. If you haven't seen it, great recommendations on what we're going to do, federal, state level, local level, to finally get that waste off our coast at San Onofre. About a 70-page report. And then here's the big one, solving the climate crisis. So I sit on the Select Committee for the Climate Crisis. Here's our 538-page report on what we need to do to solve the climate crisis. It includes 7 of my bills. I'm extremely pleased and proud of how all this turned out. This is a great plan. I think it's the most comprehensive and most science-based plan in the history of the Congress of how we're actually going to confront the climate crisis. So to check that out, climatecrisis.house.gov, and that's a lot. So with that, I want to turn to our other fantastic guest this week. It has been a very difficult time with regard to COVID-19. And Dr. Steinberg, if you could just open with some of what you're seeing and thinking with regard to COVID-19, and then we'll turn it over for all of our questions. Dr. Steinberg.
Yes, thanks, Congressman, and thanks for having me back. I think this is only my 11th time on the hall. So,
all right, we'll work on the other 2. We'll get there.
Not to correct you or anything. I can tell you've really been slacking in DC. I mean, you need to really step it up a little bit. I'm blown away by what you're accomplishing on behalf of our district, and I want to thank you for that. And Dr. Vitale, very nice to have you on. Oceanside represent. I've been an Oceanside resident for 25 years, and I'm proud, and thanks for making our school a great school system. So I don't have a lot to share today. I think any of us that back in March were sort of looking ahead to what it might look like in July. I don't think any of us had any idea that it would look kind of this grim, that we'd still be battling, with increasing numbers of cases. And it's unfortunate. I guess on a somewhat positive note, at least our president was willing to support the notion of wearing masks. I hope that resonates with people who seem to think that it's some sort of political or freedom issue. There's very little question, really no question, scientifically, that wearing masks will prevent the spread of this disease. It won't prevent 100% of the spread, but it will prevent a lot of it. If we want to get our kids back to school, people should be wearing masks. So I want to reiterate that. In San Diego County, we've had a little bit of a drop off in the number of new cases and a little bit of a drop off in the percentages in the rolling average. So we had a few days there of over 600 new cases a day. Last couple of days have been around 400 or in the 300s. So, a few months ago, that would have seemed like a really terrible day, but compared to what's been going on recently, those are pretty good numbers, and I hope that we'll continue to see a downward trend. In the nursing homes, we've had, at least in North San Diego County, we've been relatively fortunate. They're doing staff testing. Every staff member has to get tested at least once a month. Unfortunately, we're a little bit hobbled by the delays in getting test results back. But for example, in one of the facilities where I go, we've had over a dozen staff members who were positive for COVID, but we've had 0 residents. So that's a good thing. So using the PPE and so on, obviously is very helpful. So I don't think I really have much else to say. We'll just wait for the questions, and I just encourage everybody to continue to do the right thing. Or if you haven't been doing the right thing, please do the right thing. Maybe I shouldn't even put a value judgment on it. I'll just say, do the safe thing, do the kind and considerate thing, the thing that even the president now says is a good idea. So please do that.
Well, thank you as always, Dr. Steinberg. And we have a ton of questions, so I'll jump right in. First one is from Gary in Vista. Dr. Vitale, what special training has the district provided to teachers on effective virtual teaching since school ended?
Yes, thank you for that question. And actually, we've been engaged in that work even before the shutdown. We created what's called a Future Ready Plan, and our Board of Education approved it back in the fall. And part of that was a robust professional development plan. So we established what are called tech lead learners at every school who've been leading this work. So specifically in the spring and summer of 2020, we offered professional development in the area of digital learning tools, best practices in content delivery, drop-in professional learning around tech talks, ELA and math resource support, and a program that we use that's called Ludo is the gamification of learning. And so it gives staff the opportunity to learn through sort of a gaming platform where they can earn badges, and it's supposed to be a high interest kind of situation. And additionally, in instructional strategies for online English language development instruction, which supports our English learners. Now, specifically in the fall, training will be provided for parents and guardians, classified staff, and for certificated staff and administrators around accessing online tools, student assessment and progress monitoring, course curriculum and pacing design, and meeting the needs of diverse learners. And we also have a platform called KYTE, K-Y-T-E, and this is on-demand learning, any place, anytime for staff. This is a platform that I actually used to learn Twitter a few years ago. It's self-paced, you walk yourself through it, and you can learn it, and boy, am I excited that I did that. I want to say too that I was very, very pleased with our staff. When we had closures, we pivoted immediately and we provided digital support to our parents and guardians and our students via telephone. And we provided that support in Spanish and in English. And that's normally not support we provide. Normally it's just for staff, but we made that available to our community because we knew it was such a need. So we will be continuing that as well as all these various other trainings that I mentioned. And we will have specific training, and we're doing videos on many platforms to help our parents and guardians feel confident when they're helping their student navigate through this distance learning.
Thank you for that, Dr. Vitale. Another one from Sylvia, who asked, do you and or the superintendent consider teachers essential workers? I can kick it off and I'll turn it over to you. You know, I turn to the state guidelines around this, and essential workers are effectively those that have no practical way to conduct their work online. I think there's no question that teachers are absolutely fundamental to our society, and they're our heroes, as I said. I don't think we should be sending them back to work without considering the public health risks and considering alternatives to mitigate those risks. And I think that's where you know, the state of California is right now, and much less the children and the others who work in schools. Dr. Vitale, anything to add?
Well, I will add, I appreciate your specific definition, and I believe that my entire staff are essential. And yes, there's the specific governmental definition, but all of our staff, from classified to administrative to certificated, are essential. And, you know, I think it's important that people understand that a school district is made up of teachers, administrators, both on-site and off-site, school psychologists, speech pathologists, custodians, instructional assistants, noon duty supervisors, security guards, groundskeepers, and the list goes on and on and on. And some of those folks are able to do their work remotely. I, as the superintendent, am able to do much of my work remotely, although much of my work is with people, and I prefer to interact with them in person, so I've certainly missed that. So some of us are able to engage in our work remotely, and some of us, such as our groundskeepers, are not able to. But really, we're all essential to creating a school environment where students and staff thrive. And that is why we're also very anxious to get back to the real environment and leave this virtual environment.
I am with you on that. I miss our personal interactions as well, all the different events that we do and the everything from parades on July the 4th to all the different events that we do. I deeply miss all of that, and I look forward to getting back to some sense of normal as soon as we can. Lisa asks, as of right now, Vista Unified School District has said that it is sending teachers and students back to school with an option for parents to also do online learning. However, they will not mandate mask wearing for 5th grade and lower and cannot guarantee even a 3-foot social distance. How does it meet the current state and county orders for protecting our community? Well, Lisa, I think I'm not exactly sure when we received your question, but I think we got more specificity from the governor last Friday that would not meet the criteria, even assuming that we get the 14 consecutive days where we are out of the penalty box, off the watch list, and able to reopen. My recollection is that you have to have masks for, I believe, 3rd grade and above, and you have to ensure the social distancing as best you can for students and for teachers alike. And I do think that on Monday, they sent out an update acknowledging the governor's order, and I think they're holding a school board meeting this week to figure out how they implement the governor's new order and what that means for the upcoming school year. That sound right, Dr. Vitale?
Yes, it does. The governor's orders are very specific about mandates for mask wearing. It's required for staff and 3rd grade and above. It's required 2nd grade and below. It's recommended. And for social distancing, there was also clarification that for staff must maintain 6-foot social distancing from other staff and from students. And student to student is 6 foot as practicable. And that's a key piece of information because we know in classrooms where we load classrooms at 32 or above, it is not practicable to keep them 6 foot from one another, but we can keep them 6 foot from teachers and teachers 6 foot from other adults.
Well, I've been paying close attention because we have a rising 3rd grader and a rising 1st grader. So pursuant to the governor's rules, our have to wear a mask, but our 6-year-old daughter will not. Kind of interesting.
Correct.
Gail asks, many child care centers have stayed open during this entire pandemic without proper support and PPE. What legislation is proposed that will provide relief for these essential workers that are low paid and taking personal risk to care for the children of working parents? Well, look, COVID has created unbelievable financial hardship for working parents and for the childcare industry, which employs over 1.5 million people and provides care for over 15 million children. Childcare providers have experienced drops in attendance of 75 to 90%. And that leaves tens of thousands of instructors out of work, and it leaves parents without childcare. So we have already passed the HEROES Act, and I've talked about that quite a bit. It has billions in funding for childcare, and that'll continue to be one of our top priorities as we try to negotiate this 5th bill. The HEROES Act included more than $12 billion for the Social Services Block Grant program, provided $850 million to that program to fund childcare specifically for essential workers, and also established a child care stabilization fund requiring HHS to direct grants to qualified child care providers to support the stability of the child care sector during and after the pandemic. You should also know that the HEROES Act provided employees who have been on the job for at least 30 calendar days with the right to take up to 12 weeks of job-protected paid leave under FMLA, the Family Medical Leave Act. Workers could use that emergency leave for a number of reasons, including if they had to care for a child whose school had closed or whose child care provider is unavailable due to COVID-19. In addition to the work on the HEROES Act, I recently co-sponsored 2 bills on this topic to provide immediate and the child care industry. And these are going to be considered by the House as soon as this week, certainly next week. The first is by my friend Rosa DeLauro from Connecticut. It's called the Child Care is Essential Act. Creates a $50 billion child care stabilization fund within the existing child care and development block grant program that would provide grant funding to stabilize the child care sector and support providers to safely reopen and operate. And they would help childcare providers by requiring that those providers continue to pay their staff. The second bill is called the Child Care for Economic Recovery Act by Nita Lowey from New York, our Chair of Appropriations. That would expand the availability of quality child care, help workers return to their jobs when it's safe, and enable America's economy to recover from the recession by investing $10 billion in infrastructure to improve child care safety and provide $850 million to states. And that would help to fill in the gaps in dependent care for essential workers during the pandemic. So I'm very excited. We're going to move these bills. We're going to fight to see if we can get some or all of these provisions in this fifth COVID relief bill. Sandra in Oceanside says, my husband and I are very happy to be able to do online learning with our two boys, but I'm very concerned about the children whose parents are essential workers. Is there a possibility to treat elementary schools and junior high schools the way we treat preschool and daycare center for essential workers? Well, as I mentioned before, we've put forward a number of proposals to support child care for essential workers. We'll keep fighting for that. I do have concerns about asking our teachers to provide even more services and the safety precautions that would be needed. And look, as I've said before, if we're going to ask teachers in schools to do more, we better provide them with the funding to help them meet the unprecedented challenges that they're facing. Right now, we're asking our schools in our districts to do more with less money, and that's simply not sustainable. As Andrew Cuomo, the governor of New York, said when it came to state funding, said if the administration is going to pass the buck, they better pass the bucks. The same is true for our schools. If we're going to say that they need to do a lot more things, we can't just have an unfunded mandate. We have to make sure they have the funding, the resources to be able to do what we're asking them to do to reopen safely. Deborah asks, I am concerned that the Trump administration will further distribute misinformation by manipulating hospital stats. How can we, the people, require that the CDC be provided the COVID stats? That is a great question, Deborah, and I can tell you that's on many of our minds here in Washington. Just spoke with a colleague about it a couple hours ago. And for those that don't know, last week, the administration mandated that hospitals bypass the long-standing CDC National Healthcare Safety Network and instead send COVID data directly to a new site established by HHS using a private contractor called teletracking. And so this is extremely concerning. It threatens CDC's ability to gather and analyze crucial data, ignores their expertise, upends its relationships with hospitals, and it disturbs hospital workflows, disrupts public access to the data. And look, we now hear from the administration that they want to reduce funding for testing, contact tracing in the CDC in the middle of a pandemic. Not smart. So I was proud to co-sponsor something called the COVID-19 Data Transparency Act, which would require CDC to create a standardized method for state and local health departments to report COVID data and post that data on their public website. We're going to keep standing up for CDC. Kevin asks, please explain the ruling or dictate that would have made foreign students return to their native countries in the near future, and is it correct that this has been rescinded? Yes, it is correct that it was rescinded. So at the beginning of July, Immigrations and Customs Enforcement, also known as ICE, announced changes to the student and exchange visitor program that would have barred foreign students from staying in the country if their coursework had fully transitioned online. And huge backlash to this, and including a letter opposing the policy that I sent to the agency with many of my colleagues, and then lawsuits filed by many of our universities. These policy changes were rescinded. Yesterday, I voted for the National Defense Authorization Act, and it provides funding for our service members. And that legislation includes a provision to protect students that would have been negatively affected by that policy, to block the administration from pursuing that policy again. Naomi asks, as you know, Orange County wants to reopen schools, which even LA County and San Diego County have the sense not to do. I have no idea how you as a representative to Congress can address this, but something must be done. Is there anything you can do on this? Well, look, I understand the desire to get back to normal. I want to get back to normal, just like they do, but I think we have to do it in a safe and effective way. And that means listening to the public health experts, taking all the precautions that are going to help us beat this virus. As I've said countless times on these 33 town halls and counting, we can't have a healthy economy unless we have healthy people. And we've got to focus on the virus. We've got to focus on getting people healthy. That's how we can beat this virus. That's how we can get our children back to school, by getting out of that state penalty box for 14 consecutive days. That means wearing our mask, distancing, not putting ourselves in situations where we're going to unnecessarily increase community spread, rate of infection, positivity rate, and all the rest. Again, we've been on this since the beginning with the Orange County delegation, trying to figure out the testing situation in Orange County. I'm very concerned that even after we've highlighted the testing disparities between Orange and San Diego counties, Orange County has only tested 70% as many people on average as San Diego County. That's despite the fact that we now, over the last 2 weeks, have double the cases practically in Orange County that we had in San Diego County. Deeply concerned about that. We also sent a letter to the OC Board of Education requesting an immediate briefing from them to better understand their recommendations and their reasoning for trying to reopen schools this fall. And specifically, we requested the briefing to address issues of workplace safety, facial coverings, budget constraints, and hazard pay. So very simple. I'm going to do everything I can to help Orange County and San Diego County get this virus under control. Everything I can to help our counties and our communities get off the state's watch list so they can reopen schools safely and effectively, which is what we all want. It's what we want as parents. It's what we want as community members. And that's what we're going to do. Doug asks, during epidemics between 1900 and 1920, schools across the nation were situated outdoors or in well-ventilated spaces. Is this being considered for the Southern California districts in CA 49? It is, anecdotally in my conversations, we'll let Dr. Vitale comment on this, but I've had conversations now with all of our superintendents, and they are looking, many of them, at being able to be outdoors. I can tell you that'll work in some areas of the country, like in our district. Won't work here in DC a lot of the year, where we've got a massive storm outside right now. Hopefully you can't hear any of the thunder or anything like that. But obviously we're very fortunate to have great weather in our district, and outdoor schools are more acceptable. But look, everything we do like that will place more burdens on our schools, and we have to make sure that we are joining them in that effort, providing them with the resources that we need so they can do so effectively. Dr. Vitale, anything to add?
Yes, you're exactly right. And sorry about, did you say a thunderstorm? Because do you see the waves behind me? This is Oceanside today. A beautiful
It is actually a flash
day.
Flood warning. It was coming down here, and it's a bizarre week. It's been 95 to 100 degrees, flash flood warning. And I miss those waves, and I miss the 75-degree sunny day that you have.
Yeah, it's beautiful here today. Those are virtual waves, but you know they do look like that today. So yes, many districts, and ours included, have considered the outdoor spaces because of the beautiful weather that we have. And we've looked at everything from renting and purchasing tents and easy ups to provide shade spaces, to analyzing all of our outdoor spaces where there's shade, where there's some kind of cover, where we can move our picnic benches all around. We can move outdoor furniture. And still, if we do that, you're exactly correct. It does cost money because we do need to continue to supervise children. So even back when we were all considering a hybrid model and having half of our students in class, half of our students outside, we still needed to have those students accompanied by an adult. And we did an analysis of that and what that would really require just in our K-5 environment. And it was the total cost of that would be about $11 million. And that would be the staff that we would need over the course of the year and using our outdoor spaces. So I think that kind of creativity will absolutely continue. We're all very aware that ventilation is important, giving kids breaks is important, but we still are not allowed to have them using their playground equipment, right? Because of the touching the surfaces. They're not going to be able to use their hands with any kind of balls. So we are getting very creative on what kinds of activities they can participate in when we do resume school.
Thank you for that. Natasha asked, does Representative Levin believe that COVID needs to be taken care of globally? And what are his thoughts on the Global Health Security Act? Well, Natasha, I just co-sponsored the Global Health Security Act this week. It codifies U.S. commitments to the Global Health Security Agenda, which is a multilateral initiative on infectious disease threats. And look, we need to lead the world again on COVID and on many other things. I am very concerned that really for the first time in my lifetime, the rest of the developed world feels sorry for the United States that we haven't been able to get this virus under control. And that's something that I never thought would happen, and I never want to have happen again. That's not who we are as Americans. We can't give up. We can't just say, well, it's going to get worse and there's nothing we can do. That's not who we are. So yes, we need to lead the world again. Yes, we need to engage in multilateral coalitions and try to put the best American ideas forward. We've got to do that. That's who we are. Failure is not an option. Rick and Margot asked, my wife and I recently moved back to SoCal from the UK. We are both American citizens. She is a Dem. I am a Republican. We have both seen the good work you have been doing. We are, however, both interested to know your position on defunding the police. Well, welcome back to the district. And I've said this before, I'll say it again. I do not believe that the police should be defunded, but I do believe that we need reform. And I support the reforms, including an end to a lot of the practices that we, frankly, have already done a good job of in California. Things like chokeholds and more recently the carotid hold, which is now banned in our area. The no-knock warrants, the other things in the Justice and Policing Act. You know, if you look at the George Floyd Justice and Policing Act, it is, I think, a bill that meets the moment, makes sure that George Floyd and others will not die in vain, and is, I think, a great bill that I hope will be considered seriously in the Senate. You know, the Senate decided to pass its own bill. And look, it's not a perfect bill, but let's work together. Let's do something for the American people that meets the moment, that affirms that Black Lives Matter and that we're going to turn the page on a legacy of systemic injustice. And look, in my conversations with our local civil rights leaders and our local law enforcement, I've tried to bring them together. That's what we've done. I'm grateful for all who participated in our recent discussion in Oceanside, and I look forward to more of them because there's a lot that we agree on, and I worry that some try to really create division for political gain, when at the end of the day, we want to see justice and we want to see safety and we want to see equity. So I think we can get there. Chuck asks, recently there have been protests in Dana Point and San Clemente against the California health advisories dealing with the novel coronavirus pandemic. How do you counter these anti-mask events, which seem to channel President Trump's fatuous remarks over time? Well, I commend the president wearing a mask recently, at least some of the time, and saying that wearing a mask was patriotic. And I think that's great. 4 months late, but nonetheless really important. I hope that the people who are out there protesting and refusing to wear masks heed the president's words on this and know that he, just like the Surgeon General and everyone else, it's really not disputed anymore. This is an effective and really, really easy way for us to dramatically reduce the spread of this virus, which we all desperately want to see happen. I've done everything I can. I post a picture each day with a mask. And, you know, some have criticized me for that. I don't care. I'm going to keep posting a picture each day wearing a mask. I think it's one small way we can lead by example. We can get our friends and colleagues and maybe those who are less politically aligned, nonetheless, to recognize the overwhelming and obvious scientific importance of wearing a mask in a highly infectious pandemic. And again, it's not about politics or anything to do with that. It's just about basic common sense and decency for other people. That's all it is. So I'm gonna keep at it, and I hope that our friends will watch and will realize it's not a political statement. Don says, can our state and local government refuse to allow individuals from unidentified federal agencies in rented minivans to arrest or detain California citizens? Don, I assume what you're referring to is the situation in Portland and now in Chicago, and the president has threatened other cities. I am extremely concerned that we are sliding towards authoritarianism if we aren't careful here. Congress needs to do everything in its power to prevent the misuse of our agencies, of our federal resources in this manner. And for those that aren't aware, the president signed an executive order directing federal agencies to be used in cities, or specifically for CBP officers and others to be used in cities. And there are these rapid deployment teams. Many of them were unmarked or unidentified. And what we're seeing in Portland now, against the wishes of local leaders, I believe is clearly unconstitutional. And the Oregon Attorney General, I know, has filed suit. I think that any city could be next. Any city could be next. We cannot allow this to happen. We live in a democracy. And, you know, this is not a banana republic. And we've got to counter the president's actions here. We've got to make sure that we do all we can and we did in the NDAA, the National Defense Authorization Act, by basically reining in the president's authority to use these federal agencies in American cities without the consent of those cities and of those states. So we are going to do everything we can to fight back on this. Chris asks, in the introduction for the task force report on the Songs nuclear power plant. Wow, thank you for reading the report on the Songs nuclear power plant. You discussed several potential pieces of legislation aimed at breaking the impasse on disposal of nuclear waste, including establishing a standalone agency separate from the Department of Energy. Can you discuss the status of potential bills, including any schedule for filing and what measures they would include? Amazing. Thank you for that question. Thank you for reading the report. 8 key areas where we can move forward at the federal level to address the many challenges that we face. 1, create a new nuclear waste administration as recommended by President Obama's Blue Ribbon Commission on America's Nuclear Future. That's called the Nuclear Waste Administration. It would establish a new facility siting process and a new framework to achieve consent for future storage and disposal sites, including mandates for accountability and enforcement. We're in the very early stages of developing that legislation. It's going to require extensive outreach to local experts, stakeholders around the country, my colleagues in Congress. We want to craft smart policies that truly address the significant challenges our country is facing. And that can take some time. But as soon as we're ready to introduce any new legislation, you will all be the first to know. I can tell you that we're going to work on creating a spent nuclear fuel caucus. There's a number of things around safety and handling. If you look at the report, we've already had the follow-up discussion about what we do first, what we do this Congress, what we do next Congress. The idea behind this report is it's something that can be refreshed each year or every other year and every Congress, that we can continue to build on that momentum. And what you need to know is these problems did not begin overnight, and they're not going to end overnight. We had, from 1987 through the end of the 2000s, the development of Yucca Mountain in Nevada as our only geologic repository in the United States. Then it was determined that that repository could not move forward. And we thought Yucca Mountain was dead. When Trump became president, he brought it back to life until one day last year when he tweeted out, "Never mind." So now we're back to the drawing board trying to find a permanent repository. We need a consent-based approach. What everybody should know is that the waste at San Onofre, 1,600 tons of highly radioactive waste right next to the beach, that is not the real problem. It is a symptom of a bigger problem. The bigger problem is we have nowhere to send it. There's no consolidated interim storage site. There's no permanent repository. And so we're going to move forward aggressively on both. The other thing, we introduced the Spent Fuel Prioritization Act, HR 2995. And what it says is for all the nation's nuclear waste sites, there are about 120, 130 sites, move the waste first from those sites that have the highest population density and the highest seismic risk. Today, we would move waste first from the sites that have the oldest waste, and we would be somewhere in between. So somewhere within the 60 or 70 or 80 of those 130 sites. So by passing the Spent Fuel Prioritization Act, we will dramatically accelerate the timetable once we have the site identified. And that's my great hope that we can do that. So I very much appreciate all these questions. What I thought I would do, since Dr. Steinberg, I feel badly that you haven't had much of a chance here this week. This is not cool. And so I want to get your thoughts on anything that you've heard. We've talked about childcare centers, the need for more PPE, the need for more testing. I would love to get your thoughts generally on how we're doing with COVID, what our priorities should be, and where we go from here.
Great, thank you. I would say, I want to echo a couple of the things that you said. One is it also deeply concerns me that the data are no longer going to the CDC. The CDC is a trusted organization. It's been around for many, many years. And to me, that smacks of some sort of totalitarianism too, to remove the data from the scientific agency that should be getting it. You know, if they wanted to also send it to HHS for some reason for other types of analysis or something, that might be reasonable. But to take it out of the hands of the CDC, I find that really reprehensible, unconscionable, and yet not that surprising, I guess. As far as how we're doing, I say I feel slightly better today than I did a week ago, but I feel a lot worse than I thought I would be feeling right about now, based on how we were doing a few months ago. I think it's unfortunate that testing is taking so long to get back. I'm relatively heartened by the progress on vaccines, and at least we know we've got a couple of tools in the shed that can help somewhat with cases of COVID in the form of dexamethasone or Decadron, high potency steroid, and also the remdesivir. And the convalescent plasma also seems to confer some survival benefit. So it's not like we have nothing. We've got a few things that we can use. Excuse me. You didn't just see me cough into my hand, right? And
you get a free pass. You're at home.
I'm gonna go wash my hands really soon here. I won't touch anything.
That's good.
But also, I think a vaccine is nowhere in the immediate future, and clearly we've got a lot more community spread than we did not too long ago. The way to solve that is to basically be smart, try to avoid any exposure, right? So don't do indoor activities, don't be close to other people any more than you absolutely have to. Always wear a mask, don't touch your face or cough into your hand. Don't always do a lot of hand washing and disinfection of surfaces, because we know very well that there's asymptomatic and pre-symptomatic spread, right? A day or two before a person comes down with symptoms, they can be shedding a lot of virus, and we just don't know who might have it. So I encourage everybody to be extra careful, continue to be vigilant, and I'm really sorry for what people are going through, both those who have ill relatives or people who have died from this illness, and also everybody who's suffering from the difficulty of staying socially isolated. economic hardships related to their job. And this is a tough spell we're going through. We've gotten through tough spells before, and I hope, eventually in a few years, we'll be able to look back and, say, well, maybe we could have done better, but we did get through it. And I'm also relatively heartened by the fact that I hope moving forward, wearing a mask can become less of a political hot button, and people can just say, all right, if the president, late as it may be, says it's patriotic to wear a mask, then what possible reason would you have not to wear it, right? So that's pretty much all I have. Again, the numbers in San Diego are looking marginally better these last few days, and I'm hoping that's a trend. I've been really worried that we're going to get to the sort of, surge, crisis guidelines, and I really pray that we don't get to that. Thanks
What
for
are you
asking that.
Question for you, Dr. Steinberg. What are you seeing in terms of testing in our nursing homes for our asymptomatic residents as well as the employees? Do we have enough testing? How have you seen this change over time? I'm very concerned because obviously I see the infection numbers and I know the percentages from our skilled nursing facilities and other similar facilities, and that's a great concern. And then of course you read the headline now a week ago Saturday in the UT about needing to ration the tests, where you can't test as many asymptomatic people. That's a great concern as well. Any thoughts or comments on how that has evolved or where we are today?
Yes, thank you for asking that. In the nursing homes, the state has mandated that all nursing home employees be tested no less frequently than once a month. The county helped us out, San Diego County helped us out the first round, but now facilities are having to cover that themselves. But nonetheless, there are enough tests available. Each nursing home has had to contract with their own lab. And the unfortunate part about it is that in some instances, it's taking a long time to get the results back. So certainly you get a result back that's positive 5 days, 7 days later, that's 5 or 7 days that asymptomatic employee was still at work. Luckily, they are doing good, using PPE and that sort of thing. And so it doesn't appear that we've had a lot of spread that way. As to the residents, there are enough tests to go around. Again, they're considered a priority, right? So if you're somebody that's living in the community and let's say your spouse gets diagnosed with COVID, they're saying now, at least in San Diego County, many of the health systems, even if you have what they call moderate symptoms, and if you want to know what moderate is, for example, shortness of breath is considered a moderate symptom. I don't know where I come from. Shortness of breath concerns me, right? But anyway, if you have a spouse that's got shortness of breath, if you have a spouse that has COVID and you have shortness of breath, they tell you don't bother coming in for a test unless it gets really bad. Just assume you have it. And it's unfortunate. A few weeks ago, we were saying, hey, you're asymptomatic. You want to know if you've had it, or you want to know if you might be asymptomatic, go and get tested. Go to one of the drive-thrus. They've really clamped down on that. And I think that's unconscionable. It's unfortunate. And I hope that they're able to ramp up the availability of tests and also the rapidity that they get the results back with. But as of now, that's not the case. So if you want to get a test, don't assume that you can just go get one. Call your doctor or do the 211 through the county and see if you meet criteria.
Do you feel better about PPE? I know that was a concern a while back. Do you feel that you have enough at your facilities?
I wouldn't exactly call it. I don't know. It depends on what you mean by enough. It's not optimal.
Yeah.
All right. I mean, there are people that are recycling, reusing N95 masks, which should really be single use. But nobody is completely running out. People are not. Everybody's wearing at least surgical masks at work. And if they're working with persons that are under investigation for COVID or COVID patients, they do the whole deal, with a face shield and gown, gloves, and an N95 mask.
Well, thank you again, Dr. Steinberg, for everything that you are doing. I'm very grateful to you for your service in North County. Dr. Vitale, I wanted to turn it to you, and I wanted to thank you again for all that you do for our children, for our communities. And I wanted to ask what your closing thoughts were this week, and any other information that you'd like our constituents, many of whom are in Oceanside, to know about what's happening.
Well, again, I want to thank you for having Oceanside represented today. And I also just want to remind everyone that we've served just over 700,000 meals since March 13th to our community. And we've been able to do that through our tremendous food service workers who have not stopped working since the schools closed, and they're continuing to work through summer. And we have amazing volunteers that have made this a possibility. And they have created welcoming environments for people who need that service. And it's just been a beautiful opportunity to serve our community, not only our scholars, but our larger community. And we will continue to plan and continue to do our part in stopping the community spread by providing and wearing masks while we're at work, and sanitizing our surfaces, and maintaining social distance, and providing the most robust distance learning experience for all of our students. And I really want to say, not only on behalf of the Oceanside Unified School District, but all districts in San Diego, and I'll say Orange County as well, since you represent Orange County as well, that we are preparing. We've all spent time preparing. We've all had to make adjustments on a daily, an hourly, and sometimes a minutely basis. And we will continue to do that. We'll continue to stay agile so that we continue to create the best environment for our students and our staff and our community to thrive. So thank you for allowing the opportunity for Oceanside to be represented today.
Well, thanks again. Thanks to you both. Very grateful for having you, and grateful to everybody for tuning in, whether you watched us on Facebook, YouTube, Twitter, our website, some other way that I'm not aware of. I'm grateful that you did. I'm so thankful to our whole team in DC and Oceanside and Dana Point, and Jeremy, who always does a great job bringing us together in this way. I wish we were all actually together, but that day will come soon. I hope it was informative. I hope this provided you some facts and information will be helpful. I think, again, can't stress enough, follow the recommendations of the CDC, California Department of Public Health, San Diego County, Orange County. Wear your mask, socially distance. Let's defeat this virus to whatever extent that we can. Just so critical that we follow these basic precautions. Finally, I want, again, for us to remember the life and legacy of my friend and colleague, John Lewis. He was such a great example. And I hope that we can live up to that example to confront the inequality and injustice that we see in our society. The only way I see us getting through this very difficult period in our nation's history is if we try to come together, start listening better to each other, start advocating for one another, and really trying to speak up the loudest for those who need the most help. That's how we can bring about the positive change that we need. Thanks again for watching. We'll see you next week.